What are the causes of cancer? What are the risk factors for cancer? So this is the most commonest question asked by our patients and patient relatives whenever they come to us. So what causes the no particular cancer? Cancer, we can call it as a multifactorial, or so many causes will cause one type of cancer. Commonest causes we can enumerate as the habits. Commonest, that is smoking, chronic alcohol intake, lack of physical activity, obesity. Obesity is also one of commonest cause of cancer which we are seeing in our clinical practice nowadays. And then the infection. Some of the infections, chronic infections that persist in the body, they can also cause cancer. And the genetic factors. Genetic factors are the genes which runs in the family, but the amount of the percentage of this causing cancer is almost only 5%. Suppose 100 patients we take affected with cancer, we can say only 5 patients will have a caused by the genetic factor, the genes which runs in the family. So almost 95%, 90 to 95% is caused by the causes, environmental factors, lifestyle changes, food habits, weather changes, pollution. So there are so many causes which are environmental related. So genes related or familial genes occurs only in the 5% of the patients. So I will speak more about smoking tobacco or smoking BDs or smoking cigarettes. In my last video I was telling about commonest cause in males is the head and neck cancer and the lung cancer, and you must be surprised that 95% of these cancers are caused by smoking tobacco, chewing tobacco or smoking BDs. So that is why we always advise our most of people to stop smoking, stop chewing tobacco. So one of the advantage of smoking tobacco is, suppose a person stops, chronic smoker or chronic tobacco chewer stops smoking, stop chewing tobacco today, the percentage of risk of getting the cancer or heart attack or the increase in the diabetes will comes down only after 10 to 15 years, not immediately. So that is why we advise most of our people to stop smoking as early as possible. So you have to educate your relatives, your friends to stop smoking, to tell about the ill effects of the smoking. It can cause the head and neck cancer, lung cancer, as well as it can indirectly influence the esophageal cancer, stomach cancer, bladder cancer, and in females breast cancer and uterine cancer also it can influence. So this is about the smoking. Alcohol also, when combined with smoking, it almost doubles the occurrence of the cancer risk in some of the individuals, especially the esophageal cancer, especially the stomach cancer and the uterine cancer and so on, even the colon cancer. So coming on to obesity, the lack of physical activity, obesity is also considered as one of the strongest risk factor for most of the cancers now, especially the breast cancer, the uterine cancer, the colon cancer, the prostate cancer. So the physical activity should always be there. That is what the WHO recommends, that every person should have at least 45 minutes in a day. They should have a moderate to vigorous exercise at least 5 days in a week. So that is the World WHO prescription for maintaining the physical activity or maintaining the ideal body weight. So then coming on to the diet. So most of the people, because of the lifestyle changes, they addicted to the having a preserved food or junk foods are more common. So these also indirectly or smoked food. These also indirectly influence the occurrence of the cancer. So because they have a lesser amount of antioxidants in the nutrition value is less, so the occurrence of the cancer is also more. So we always advise our people or common people to have a ideal balanced diet which contains more of vegetables and more of fruits. So 3 successful formula we always advise for most of the people to have a ideal body weight, ideal balanced diet, and maintain a ideal physical exercise or physical activity should be maintained to keep not only from the cancer away, also from other diseases coming to any individual. So there are infections which can cause cancer. For example, commonly we see in women cervical cancer which is caused by human papilloma virus. So HPV infection is causes the cervical cancer, and even the hepatitis B, hepatitis C virus can cause liver cancers. So one of the advantage of this HPV infection which causes cervical cancer in women is we can prevent this. So vaccine preventable cancer. So some of the people will always ask, what are the things we can do to prevent the cancer? So this is one of the example where giving the vaccination, HPV vaccination, which is available already widely everywhere. So you can consult your doctor for this. So HPV vaccination given at before the age of 16 years for almost all the girls, they can prevent their cervical cancer in their lifetime. So this is about the causes of the cancer, about the risk factors and early diagnosis. Early diagnosis, I will stress upon this here, because early diagnosis of any cancer, we can cure that cancer. So most of the cancers in India comes to our clinical practice comes in the advanced stage because of lack of knowledge, because of the negligence, because of lack of availability of the treatment. They come in the advanced stage. When the patient comes in advanced stage, we cannot cure that cancer, only control of disease is possible. So whenever the patient comes in an advanced stage, when we call it as a stage 1, stage 2, we can cure that cancer. Suppose the patient comes in stage 3 and stage 4, we cannot cure that cancer. So we always advise any particular symptom of cancer, usually if it is there for almost, suppose cough is there for a particular individual for almost more than 1 month, better to go to a medical doctor, get it checked, get a X-ray, get a CT scan, and then we can diagnose that cancer early. Suppose the patient prolongs the symptoms for many months, so the cancer may get advanced and it is very difficult to cure. So this is all about the diagnosis, cancer risk factors and early diagnosis. If you have any queries on this, please get back to us. Thank you.